The purpose of the McConnell test is to measure one's VO2 max, which is the maximum rate of oxygen consumption measured during incremental exercise. Before we begin this test, we place the mask over the subject's face in order to obtain measurements. The subject begins at a pace of 4 miles per hour for 1 minute as a warm-up. This warm-up allows muscle temperature to increase, enzyme activity to increase, increased availability of oxygen, and prevention of injury. As you can see, some of the wires are getting in the way, so we must move them out of the way. For this exercise test, it is important to have one person to the left of the subject in order to adjust the speed, one person behind just in case they fall off, and one person at the metabolic cart looking at the values. The subject has been exercising at a pace of 4 miles per hour for 1 minute. It is now time to increase the speed to 5 miles per hour. She will remain at this speed for 3 minutes. As mentioned before, it is imperative to have one person standing at the metabolic cart watching the values. During this test, one may use the metabolic cart to examine what variables are being measured. Although we are mainly measuring her maximal oxygen consumption, we are specifically looking at her absolute and relative VO2 max, METS value, ventilation, heart rate, and respiratory quotient. The subject has been exercising at a pace of 5 miles per hour for 3 minutes. It is now time to increase the speed to 6 miles per hour. She will remain at this speed for 3 minutes. The results will show whether or not one has reached their true VO2 max. VO2 max is measured in milliliters of oxygen used in 1 minute per kilogram of body weight. Absolute VO2 refers to the measurement of oxygen consumption that does not take body weight into account, whereas relative VO2 refers to measurement of oxygen consumption that does take body weight into account. This value is determined by taking the absolute value of VO2 and dividing it by one's weight in kilograms. METS describes the exercise intensity. One may use relative VO2 divided by 3.5 to calculate the value for METS. We use the number 3.5 because it is the average resting VO2. Ventilation refers to breathing. It is determined by the tidal volume, which is the amount of air we breathe in and out in one normal breath, and the breathing frequency. Respiratory quotient refers to the ratio of carbon dioxide evolved to that of oxygen consumed by the subject. The equation reads RQ/RER equals VCO2 divided by VO2. VCO2 refers to the carbon dioxide one is expelling, and VO2 refers to the oxygen that one is using. This value determines the energy substrate that is being used. The subject has been exercising at a pace of 6 miles per hour for 3 minutes. It is now time to increase the speed to 7 miles per hour. She will remain at this speed for 3 minutes. Although many use the terms VO2 peak and VO2 max synonymously, they are different. The former refers to the highest VO2 that was attained during the test, while the latter refers to the highest value attainable by the subject. During this maximal exercise test, subjects always have a VO2 peak. However, they do not always reach their VO2 max due to muscular fatigue. Cardiovascularly, they can continue, but muscularly, they feel as if they cannot. In regards to the criteria, one has reached their peak when their heart rate is within 10 beats per minute of their maximum heart rate, which is determined by the equation of 220 minus their age, when RPE is 18 or above, when blood lactate levels are around 8 to 10 millimoles, when their RER is close to 1.2, and when they feel volitional fatigue. One has reached their VO2 max when there is a plateau in VO2 with an increase in exercise intensity. In other words, the oxygen intake during an exercise intensity at which actual oxygen intake reaches a maximum, beyond which no increase in effort can raise it. This testing is important. VO2 is oftentimes used as an overall indicator of cardiovascular fitness. The higher the VO2 value, the better the individual's cardiovascular fitness. VO2 max tests are common for endurance athletes. However, anybody can participate in this test in order to know what their VO2 max is. The results of this test can help trainers and clinicians set realistic goals and assess improvements among their clients and patients. Many people are inefficient exercisers with no understanding of what specific heart rate, intensity, or duration would best help them reach their specific goals, such as fat burning, endurance training, or cardio conditioning. An initial VO2 max test can clarify the specific target heart rates that will enable each individual to reach their fitness goals more effectively, with less fatigue and fewer injuries. VO2 max is a valuable tool for serious athletes to assess performance and evaluate training routines. Even though extensive training can sometimes cause an athlete to reach a plateau in VO2 max, he can still use his VO2 max test results to make further improvements in performance. This is accomplished as he pushes to increase anaerobic threshold and maintain that threshold for longer periods of time. This enhances both endurance and cardiovascular performance. The subject has been exercising at a pace of 7 miles per hour for 3 minutes. It is now time to increase the speed to 8 miles per hour. She will remain at this speed for 3 minutes. According to the values on the metabolic card and her running economy, she is approaching her VO2 max. Therefore, she is instructed to jump off. The person to the left of her and the person behind her must open their arms and be ready to catch her just in case. These are the subject's results. We looked at her VO2 levels, VCO2 levels, respiratory quotient, and ventilation. At 13 minutes and 31 seconds, she reached a respiratory quotient of 1.2. At 13 minutes and 35 seconds, her relative VO2 read 50.2 milliliters per minute per kilogram. Her highest ventilation value was 86 liters per minute. As you can see, she was approaching her VO2 max. It is also imperative to note that this maximal exercise test does not usually entail a cool down period. Thank you for watching, and we hope that you learn more about the McConnell test.